come here, they lie down on the bed, we leave. Oh, let me just wait for everybody.
You know how you said you try to get the patient to take it all up
yes.
with the screen. How many actually do that?
Most of them.
And how many just keep it on?
Most of them.
Right.
Most of them take it off. By then, I think I've won most of their confidence.
Yeah.
If you haven't won their confidence and they're still a bit dubious about you, then I think some of them... Look, there are some ladies, and again, it's like the Muslim ladies.
Yeah.
You know, their bodies should never be bare. It's like having a male even do their ultrasound. It's quite a tough procedure. It's those sort of people, and some people will just tell you openly, I think this is absolutely barbaric, you know. I don't like people touching my breast generally, and I say, look, do you want me to do a mammogram?
Yeah.
It's the only way I can do it. And they'll normally say, yeah, just get on with it, I just want to get it finished. But they don't normally ever relax very much with you. But I would say 85% of my people I get to take the gown off as soon as I'm ready to go, because doing the films is quick.
Yeah.
Digital, it's very quick. Being without your gown on is maybe about 6-7 minutes.
Right.
And then put your gown around your shoulders. I actually always show the patients their forms, because I know they don't know too much about what's going on, and I just explain, when I'm pulling your arm like this, it's not because I'm being mean, it's because I've got to get this whole pectoral muscle on. And when I'm pulling the bottom of you on, I need to see this little V at the bottom, because otherwise I haven't got your whole breast on. And when I'm pulling you forward like this and I'm right on your chest bone, it's because your breast actually joins right onto there. So once you've actually talked people through, you'll actually find they're actually okay with you.
And people take off their gowns?
No, they don't. No. They come in here, they have their gowns on, because we just change everything after every patient. They just come and lie down, and depending on which side we're going to have a look at, I just make sure that their ribbons are untied and everything, so that the radiologist, when he comes in, can just roll them to whichever side. There's always a chaperone in here if it's a male. If it's a female radiologist, you don't have to have anybody, but if it's a male, we always have a chaperone, and that's normally Sarah. She's not here today, but she does the arriving of the patients and getting them in and out of the room.
Right.
And she's actually wonderful, because she jabbers and she warms with them all at ease. So we have this little pad that we just always gown up and clean. So if we wanting to have a look at her right hand breast, instead of her just lying absolutely flat, we just roll them through 45 degrees, just pop that in underneath their shoulders so that they're sort of lying a little bit to the side, so you can get to the breast a bit easier. Again, now at this stage, gowns drop a little bit, and that's why I said I'm not really very keen on a short gown. I would much rather have the normal length gown on the stuff we've got there, you know, so that at least if you're opening up at the top, you can close at the bottom, so that people... Now, even if people have got a skirt or pants or something on, they're often hipsters, and they're often quite low, so often sort of quite a bit of the tummy still shows with them, so I just feel that if you've got a little bit more gown, just to cover it. See, this is where breast screen is so different. Breast screen don't do ultrasounds on anybody. So breast screen are well women. They're coming in, they have no lumps, they have no concerns. They come in and they have their 4 images, and I think from breast screen, they have a cubicle attached to each of their rooms. So the ladies actually come in, get changed, and go back into their cubicle and leave. There's no big communal. I might be wrong. I just went down when they were first designing it. So it's very quick. Even if they see something major on that day, they don't do another thing on that lady. It's screening, it's 4 films, that is it. Then they all get double read, and the ones that look suspicious get recalled. And then on the day that they get recalled, it's the day that they will have an extra view, like a spot view or a magnification view, an ultrasound, and probably a biopsy on the day. Either under ultrasound guidance, if you can see it under ultrasound, or if you can't see it under ultrasound, you've got to do it under mammogram guidance, and that's called a stereotactic biopsy. So that's the only time that breast screen actually have people sitting in gowns for a little while.
Right.
And that's one day that they come in, and maybe they're in a gown for maybe 2 hours at the most.
So biopsy is taking a core sample of the needle, right?
Taking a core sample.
Yeah.
Having a look at it, getting it all lovely, cleaned, local anesthetic, pop a needle in 2 or 3 times to get little slithers of tissue of the area that you're looking at, goes up to the laboratory, takes 1 week for those results to come down. And in our case, anybody who comes in for a biopsy, then goes to see somebody in the breast clinic, which is every Wednesday, to get their results. Anybody who has a biopsy comes back to get their results, even if it's benign.
Yeah.
But anybody who's had to have a needle popped in needs to talk to somebody to say what was found. So from here, we might now have seen that there is something a little bit ugly that we don't like, and if it's on a Wednesday and we have a radiologist here that can do biopsies, we might say at the end of our session we can do a biopsy for you. Or if it's a very palpable thing, we're going to ask one of the breast surgeons if they could just have a look at you today while you're here. We try and make it a triple assessment if we can for the really obvious cancers. And then because breast clinic is already fully booked, these people now go and sit in the waiting room until it's their turn to be slotted in. And I'm not joking. Some of them could be here at 8:30 and still be here at 12.
Yeah.
So
Hence the
it
vast
can be a
amount of
very
new
long day.
ideas.
Again, Sarah was an air hostess, so she serves tea and she serves coffee and she tries to make people feel, or else we say to people, it's going to be about an hour and a half or two. Would you like to just get dressed and go to the coffee shop, or just go out for a little while and come back rather than sitting? Because you can imagine sitting for those hours is awful.
Yeah.
So, I think that's about what I can tell you. What I want
And
to
then
do
that
is
week
just
I'd
show
go
you some other
back,
gowns.
and then I'd take the gown
Yes.
off.
And then once we've finished, once we've done a biopsy, once we've finished with the ultrasound, we say that's absolutely fine. They go back with their bag of clothes, go and get changed, and they're off.
Right.
Just want to, while you're in here, I just want to give you those other two gowns. I just want to show you the other two that we do have.